Nearly 2 years ago, voters in our state approved the use of medical marijuana.
But it's not always easy to navigate the system, so that's where Michigan Holistic Health comes in.
They already have a location in Kalamazoo, and today they're opening a Grand Rapids clinic.
Dr. Dave Crocker is here to talk about their mission and what patients can expect. And so congratulations for your expanding.
Thank you.
Here to a different area. Exactly, what is the process? Because I think, as Terry said, a lot of people are, having a hard time understanding the law, what steps they should take.
First off, patients decide that they might benefit from medical marijuana, either through research or having spoken to friends or doctors. They would then gather their medical records that pertain to whatever qualifying condition they have. Those records would then be collected by our office. We'd review the records, bring the patient in for a brief history and physical, and decide based on all that information whether or not they qualify.
So it sounds like you're really able to streamline this process, because it's very complicated, I think, for people who don't have someone like you to assist them.
It is a complicated process, and we've treated over 1,000 patients so far, and we've honed the process fairly well. It's very smooth in our office.
So tell us, where is your new office in Grand Rapids located? Because I know you already have one in Kalamazoo, and you've been serving patients there for quite a while.
Right.
Tell us about this new opportunity.
Our new office is at the Kennesaw office complex at 3167 Kalamazoo Avenue Southeast. We opened today. If you drive off of 131, take exit 80, go about 3 miles east on 36th, and then left on Kalamazoo Avenue Southeast. We're about a half a mile down.
It is really pretty easy to find. What were you finding in your Kalamazoo office? Were people coming from many, many counties away to get the expertise that you had to offer?
They were. We were getting patients from all over southwestern Michigan, and even up north some. We had several patients that had asked us if we planned to open an office here, and we had gotten a lot of business from here. So with all the business that is here, we decided to go ahead and open an office here.
Through your experience, Dr. Crocker, what have you seen with some of the patients that, through your career that you have met with and talked with about medical marijuana and how that has played a difference in their health care?
I'd say the vast majority of our patients, probably 80% or greater, seek medical marijuana for the management of chronic pain. A lot of our patients are on chronic narcotic pain management, which has its limitations. Many of our patients suffer from some of the ill effects of escalating doses of narcotics, including personality changes, and they've found marijuana to be a preferable way of treating their chronic pain.
Those narcotics can be just so highly addictive too, so you're managing not just the pain but then also these other symptoms as well. Take us through the cost, and does insurance cover this at all?
Right. At this point in time, insurance does not cover the exam. Our cost in our office is $200 for the original qualifying exam. Patients are not charged if they do not qualify. Recertification exams are $125 in our office. The state charges $100, which can be reduced to $25 for people with financial need.
Is that like a licensing or an application fee through the state?
It is an application fee.
Okay.
Yes, ma'am.
So there is a process.
There is a process.
And, it can be, take some steps. Right now, how far... I understand the state is a little bit behind in processing because this is kind of a new system that it's put in place.
The program is much bigger than the state anticipated. My understanding is that they thought about 500 patients would sign up in the first year. We've had over 13,000 people apply.
Wow.
So they are understaffed. It's about 3 to 4 months delay to get your card once you apply, assuming you're approved. What they've done to remedy that is say that 20 days after they receive your application, then a copy of your application becomes your card until your card arrives. So there is help for those. They don't have to wait for the full 4 months.
Yeah, that streamlines the process. Well, I know a lot of people have a lot of questions. We'll, of course, get this segment on our website, and people can get in touch with you through a link to your website as well. Thank you so much
for
coming on.
I appreciate it.
Good luck with your new location.
Yes, exactly.
Thank you.
Congratulations.
Thank you.